So, good morning everyone. Our lesson for today is understanding phlebotomy. So first we have our three objectives, in which first is we describe the evolution of phlebotomy and the role of phlebotomists in today's healthcare setting. The second one is to describe the traits from the professional image and identify national organizations that supports professional recognition of phlebotomists. And lastly is to describe the basic components of communication as they relate to the healthcare and how appearances and nonverbal messages affect the communication process. So now let's start with the history. So in early medical technologies, theories and developments, we have Hippocrates in 360 and 377 BC, which he stated that the diseases was the result of an excess substance, which are the blood, phlegm, black bile, and yellow bile, which is seen within our body. So from the Greek word, phlebotomy comes from the Greek word phlebos, which means the vein, and tom, which means incision. And it started during the Stone Age that they used tools just to cut the veins. And then in 1400 BC is in Egypt, in which there are proof in a tombstone that shows how they do the phlebotomy. And lastly is the Guild of the barber surgeons, which we have two kinds of barber surgeons, which are the long road surgeons and the short robe surgeons. So the barber pole. So as what I mentioned earlier, we have two kinds of surgeons. So first is we have a short robe surgeons, in which they were forbidden by the law to do any surgery except for bloodletting, wound surgeries, cupping, leeching, shaving, or tooth extraction, and enema administration. But for the long robe surgeon barbers, they use this barber pole, in which they place a strip pole from which a bleeding bowl, which is this one, was suspended outside their doors. So the pole is represented, the rod squeezes by the patient to promote bleeding, and the white stripes here represents the bandages. So let's move on to the next one. Is we have the cupping and the leeching. So medicinales is what they call it in those times and up until now. So leeches are common first in Egypt, in which they value it or call this as the leech therapy, in which lies in the component of a worm saliva, and which contains a local vasodilation and a local anesthetic and hirudum anticoagulant. Anticoagulant means it's a substance that prevents clotting. So they are the blood-sucking animals that helps helps the people for their medication to getting blood. And for nowadays, we don't use leeches. We now use cupping, and the most common one is venipuncture, which we use needles. So as we know, we have a leech jar in mid-18th century in France, which I explained earlier, that the worm saliva are the local vasodilator and the local anesthetic hirudin. So as early leech jars were glass and later once ceramics, so within the last decades, leeches have made comeback defenders from the compilation of the Scorus surgical replantation. So this is where they keep the leeches to be alive. They just put a little amount of water, just enough for the leeches to survive. So these are the kind of jars that they use. This one is already as one of a modernized leech. So bloodletting phlegm. So this tool is one of the most common tool in history, in which they just use this different kind of blades represent different kinds of cutting. If they need to cut it in a very deep one, they have a blade for that. And for just a slight one, just getting a sample, they also have a blade for that. So that's the bloodletting phlegm. And so phlebotomy today, as we know, obtains blood for diagnostic purposes and monitoring of prescribed treatment. So remove blood for transfusion at a donor center, and it removes blood for therapeutic purposes such as treatment for polycythemia cythemia. So, venipuncture, it involves collecting the blood by penetrating a vein with a needle and syringe or other collection apparatus. Capillary puncture, it involves collecting blood after puncturing the skin with a lancet. So, this one, bloodletting phlegm, or also known as a blood lancet. So, the phlebotomists are trained in various techniques to perform phlebotomy procedures. They collect blood for laboratory analysis that is necessary for the diagnosis and care of a patient. So, manual dexterity, special communication skills, good organization skills, thorough knowledge of laboratory tests, requirements, and department policies. So here are the duties and responsibility of a phlebotomist. First is they prepare patients for collection procedure associated with laboratory samples, collect routine skin punctures and venous specimens for testing as required, prepare specimens for transport to ensure stability of sample, maintain patient confidentiality, perform quality control checks while carrying out clerical, clinical, and technical duties, transport specimen to the laboratories, comply with all procedures instituted in the procedural manuals, promote good public relations with patients and hospital personnel, assist in collecting and documenting monthly workload and recording data, maintain safe working conditions, perform laboratory computer operations, participate in continuing education program, or collecting and perform point-of-care testings, perform quality control checks on POCT instruments, perform skin tests, process specimens and perform basic laboratory tests, collect urine, drug screen specimens, perform electrocardiography, perform front office duties, current procedural terminology, coding, and paperwork. So the phlebotomist, for their official recognition, they have a certification which is an evidence that an individual has mastered a fundamental competence in a particular technical area. And second is they have their licensure and registration, and which is a document or permit granted by the state indicating permission for a person to perform a certain service after having met the education and experience and successfully completing an examination. Continuing education, it is important to keep knowledge base and skills up to date, in which we have to, medical technologies has 45 CPD units to renew their license for a, that's what they use for the continuing education, attending seminars, not regularly, but just to update their license. So the phlebotomists have a here are listed a different certification agency, their certification title, and their certification initials. So first is we have the American Medical Technologies. So we have here a registered phlebotomy technician, which is RPT or AMT is what we called it. American Certification Agency, Certified Phlebotomy Technician, or CPTA, ACA, American Society for Clinical Pathology. On this one is phlebotomy technician, or which is also known for a for the pathologist, the BPTA ASCP, National Center for Competency Testing, National Certificate Phlebotomy Technician, NCPT or the NCCT, National Credentialing Agencies, which are the Clinical Laboratory Phlebotomies, CLPLB and CA, National Health Career Associations or the Certified Phlebotomy Technicians, CPT and HA. So the phlebotomist has public relations and client interactions. So first is that they need to recognize the diversity. So phlebotomist promotes goodwill and harmonious relationship that directly improve health outcomes, that quality of service and public relations. Second is they need to have professionalism to conduct, and qualities that characterize a professional person involves professional behaviors or characters including this following. So first we have is the integrity, which requires a person to do what is right regardless of the circumstances. Second is the compassion, being sensitive to a patient's need and being willing to offer assurance in caring and interested way. Third one is motivation, direct reflection of a person's attitude about life. That's very needed. Dependability, taking personal responsibilities for his or her own actions. Diplomacy, effective communication skills, and tact while dealing with a patient even in stressful situations. And ethical behavior, conforming to the stand of right and wrong conduct to avoid harming patients in any way. We need to have all these behaviors or characters, not just in being a medical technologist, but being a professional, of course. So the phlebotomist and the patient, so the phlebotomist must recognize the rights and privileges of a patient and has while in a hospital or other healthcare facility. So we have the patient's bill of rights with the American Hospital Association in 1973. So the patient care partnership by the AHA board in 2003. What to expect during a hospital stay. So first of all, we all know we need to have a high quality hospital care, a clean and safe environment as well, involvement in your care, protection of your privacy, help when leaving the hospital, help with your billing claims. So the phlebotomist and the patient. So for confidentiality, which is very, very important for our part and for the patient's part, seen as the ethical cornerstone of the professional behavior, serves to protect both the patient and practitioner. Health Insurance Probability and Accountability Act, HIPAA Act 1996. So lastly is the communication skills. We need that, means by which information is exchanged or transmitted, one of the most important process that takes place in a healthcare system. Because without communication skills, we cannot communicate with our patients properly, so therefore we cannot do our work as a professional. So that's all, and thank you for listening. I hope you learned a lot, and till next time. Thank you.